Hello everyone, here I am sitting with Dr. Sangeeta Chatterjee. She is gynecologist and obstetric doctor, consulting for many years. So I'm a physiotherapist and I thought to interact with her about women health. So we were wondering that how to create awareness for women's health. So I was asking her, what do you think, ma'am, where people need awareness in these areas like women health? What do you think about it?
See, frankly speaking, it is like cutting across all age groups. The problems, the gynec problems are different for the different age groups. So there's one part like, just those who have just attained puberty. So for those children, it is like initially the mothers, when they come to us, it is like they have already, past, they have already crossed through that stage of problems for few months. So it is initially they feel that okay, fine, it's okay when the periods are irregular or they have a lot of cramps and all that. So that is taken, they think that aisa hota hai initially, that part of it. But our advice would be that just to let the girl handle it and to make them understand that at what stage they need to go in for some investigation or something, they need to consult a gynec. If at least when the daughter has attained puberty and she started with the periods, both for the mother and the daughter, it's better that they meet a gynec or the physician so that they understand the thing better, that is any intervention required or what is happening is okay, they will get over it. So these are few things even for new
complications like if they don't come for early detection or
early detection in the sense it is basically right away, it is not like they're going to have any complications that way, but sometimes the girls go through a lot of they have menorrhagia, the periods are continuing for a longer period of time and they have very heavy bleeding and all that. So that is sometimes a little bit of a psychological upset for the child also. So like how to allay their fears that this is okay, we can give them some medications if need be, if it is going overstepping the duration of flow which is normally supposed to happen. So if any medication is required and what are the nutritional supplements that should be given at that point of time, because they are suffering from blood loss, and this is a period wherein we also have to understand that the growth also simultaneously of the child should not be interfered with. Those it's like there's a taboo, okay fine, periods aa gaye to abhi ye activity nahi karna hai, wo nahi karna hai. It's not really like that. If they have heavy bleeding, fine, we give them a little rest, but let them go ahead with a normal life at this age, the way they are supposed to do with sports, with whatever activities they want to do.
What do you think they will have problems if they don't come for this investigation?
If it's the initially 1 year, okay fine, if there is a little bit of irregular periods, comparatively slightly heavier periods, little pain and all that, giving them mild sort of NSAIDs, painkillers and all, that's okay. But suppose the cramps are increasing, suppose the irregularity is becoming very much, then we need to find out if it's becoming very irregular periods and the child is gaining weight, becoming very lethargic and all that, then we need to find out whether there's a tendency for that girl to get PCOS, polycystic ovarian syndrome. So that is where the investigations might be required, that is where the intervention of the doctor might be required. And another thing is that initially we put down to cramps, okay fine, ye spasmodic dysmenorrhea hai, like it happens, spasm hota hai, pain hota hai, we're giving them mild NSAIDs, all those things. But we need to find out, like sometimes it becomes so severe that is incapacitating for them to lead a day-to-day, a normal life. Every period they are very scared of it. So whether there is any tendency that they might have endometriosis, then we need to find out, and if any treatment is to be given, if any counseling is to be given. For PCOS and all that, there is sometimes the children, the young girls, they go through, they do a lot of Google survey and they get a tag there कि मुझे तो PCOS है, but how to deal with it? It's not a very big issue. It can be taken care of.
So what lifestyle changes you suggest?
Yes,
what is the role of doing exercises?
Definitely, that's a big thing which we keep saying, whenever we are detecting PCOS, we're giving them medications fine, but every time the stress is being put on lifestyle modification, in which diet and exercise play a major role, because it is what happens is that exercises means people think, okay, fine, occasionally I've done a little okay, sort of a thing.
Yeah.
But it's not like that. It has to be, the exercise has to be a planned one. Regular thoda sa, like what we say is, if they're going for walking, jogging, at least 5 days a week has to be put down to that.
Yeah.
Or if they're doing their routine, some of them are into sports and all that, so they have to pursue that. But exercise is a must, because that, in a long way, diet and exercise go a long way in reducing. I would not say it is not like the PCOS will not go
better
away.
management.
It's managed better. They have less symptoms, they have less complications, less problems later.
I have heard many things about exercising help in enhancing the fertility.
Yes.
What is your opinion on that?
Yes, definitely, because see, fertility factor also, sometimes what is happening now is that, going to the career options and all those things, women are going in for the planning a family slightly later. So it's like at that point of time, it is maybe the ovarian reserve is not that good, and some of them are already into that thing of having irregular periods, PCOS. A lot of women with PCOS are coming with the problem that they're trying to conceive, they're anxious to conceive, but they're not conceiving. It's taking time. So they have irregular periods. Now the thing is, we keep advising that one thing, you have to go ahead with exercises, and that will, the hormonal cycles will be better.
Yeah.
And definitely the ovulation, there's an impact on the ovulation. For the women with PCOS, there's definitely exercises play a role in giving them a better, chances of ovulating.
So definitely the fitness is directly related with the fertility.
Correct. So that goes a long way in helping them conceive naturally. So many times, there are lots of times when we say that, okay, fine, the other parameters are okay. You have polycystic ovaries, but the other parameters are better. So along with the whatever little medical, medication, supplements, whatever we can give, we're giving. Along with that, we ask for exercises and stick to a healthy diet.
Personal experience I have that I have seen many patients who had this fertility issue, and then we are treating them for some other problem, maybe back pain or and then we advise them general exercise, and overall fitness improves. And we have seen that later on when they investigate, they have better results in terms of enhancing their fertility.
Definitely, that does happen. So they come back, like I said, we've just told them that, have a healthy diet, go for exercises, change your lifestyle. It is like normally they are into a little late nights and all that. So have a healthy diet, sleep at the right time, exercises, all these things, and they spontaneously on the natural, they conceive and they come back.
Correct. What about pregnancy? When they conceive, we conduct antenatal, postnatal classes, and we talk about exercise. We are expert in exercise.
Right.
So even I have seen a lot of patients who are suffering from back pain during their pregnancy.
Yes.
And we got a call from hospitals about treating back pain.
Yes.
And then we have realized, they are not aware, especially women who are undergoing pregnancy, they are not aware role of exercise, posture correction. What is your opinion on that?
Yes, it goes a long way, because some of them have excruciating back pain. Sometimes it's pelvic pain. They complain about all this. So our advice is that even the antenatal period, go under the guidance of a physiotherapist who is an expert in all this, and they will definitely know what is the what you can do and what you can't at this stage. And postnatal, many women I have advised, because what happens is postnatally also they sit for long hours, they're breastfeeding and all that, so there is some sort of a problem going on with the posture again. So the pain doesn't go so easily, and some people, even with that pubic pain, pelvic pain and all that, they get a lot of relief when they've started the physiotherapy the earliest that they can. They do get relief. So that should be a part of our regular postnatal sort of discharge when we're discharging them and they're coming for a follow-up. The advice is there from our side, especially those who are facing the problem, definitely for them.
So regarding that, we have organized one webinar and 3 days workshop
That's
for women.
Good. I think they will know when to go and seek help, because there's a limitation to giving the medicines, one. Second is they will give the symptomatic relief at that point of time, but in the long run it should be they should get back to their normal self as early as possible.
So here we come across a lot of pelvic floor dysfunction cases. So a lot of things revolve around this pelvic floor muscles.
Correct.
What do you have opinion about pelvic floor
Yes,
dysfunction?
Definitely, because even with the pelvic floor dysfunction, it is like, post delivery and all that. There are women, there are even women who've delivered 3-4 years back, and they come back and they say they do have, we understand that there is, they give the complaint of, something, they feel something coming out per vagina and all. But that is basically either they have a prolapse or a sort of cystocele, what we say, rectocele, all those things. So in general, whenever we find that there is some problem with their pelvic floor muscle dysfunction and all that, then broadly we tell them pelvic floor exercises. But what are the pelvic floor exercises? That I think the physiotherapists will be definitely the better experienced people to guide them there, and that is sometimes the only treatment to help them, recover their function of the pelvic floor muscles.
For muscle strengthening, no medicine.
No medicine. That's what we explain to them, that there's no medicine to help them. Sometimes some people have prolonged second stage of labor and all that. After that, they come with these complaints. So the physiotherapist is the best person to help in this, because what comes into the pelvic floor exercise and what is going to be suitable for this particular woman, so you will be able to guide better, definitely.
And what about this perimenopausal phase, where they have some hormonal changes?
Correct.
Estrogen level is reducing.
Exactly. So one of the complaints in that is, they start off with all the joint pains, knee pain, backache, all those things. So from our part, we're giving them supplementation. That's all we can do. Supplementation in the sense like, the vitamin supplementation, calcium, vitamin D and all that. A little bit of, we put in a little isoflavones and all that from our side. But it is like they are genuinely, there is a problem. They are facing some problems wherein they need the help of the ortho also and also the physiotherapist. So that is what my advice is, that you have to visit both of them, and whatever deficiency is there, I mean from the surgical point of view and also from the sort of rehabilitation point of view. So that has to be taken care by the physiotherapist.
So apart from this, you're talking about some screening or investigation. What are those tests which you suggest for people to go for in the beginning, maybe before pregnancy or pre-pregnancy screening or during menopause?
Pre-pregnancy screening is, now what we are doing is, if it is like, generally people come to us when they are trying and they are not being able to conceive. That is the time. Very few people come, okay fine, we want to go ahead with the pregnancy, and what are the things to do. So there are the few hormonal tests that we say, whether if they've not done their thyroid profile, prolactin, AMH is something we stress on, because especially, we need to know that whether to let them, to suggest that, okay fine, you're 30 plus, but you can try on your own, it's okay, how good is the AMH level and all that. So these are the few screening tests, and we do a sonography of the pelvis, one thing which is going to tell us whether the female, the lady has any problems of PCOS or not. These are the general ones which we are doing pre-pregnancy. Rest is pre-menopausal, if you say. Pre-menopausal also, it is like we're doing the routine, the sugar levels, we're checking on the vitamin D levels, we're checking on the vitamin B12 levels, and if we really want to know, pre-menopausal, if they're having very irregular periods for a long period, they're not getting their periods for long duration, then they also want to know that whether I'm falling into the menopausal bracket or not. Then we go ahead with FSH, LH and all that, which gives us an idea, okay fine, they will probably they are in that premenopausal or menopausal age group. So these, and rest is like, sometimes we also want, if some of them are really complaining of severe knee pain, back pain and all that, if we have to do a BMD, bone marrow density and all that. So these are the few screening tests, also sonography, and the routine from our gynac point of view, post 35, we advise other things, that is pap smear, mammography, all those things. Those are from the gynac point of view. So that also we suggest definitely in that age bracket.
So first thing, they should take care of some symptoms they're getting related to their maybe period or some problems which they're facing around pelvic floor areas, like those reproductive organs areas, right? And then maybe if they should not hold on that, they should meet to a gynecologist or obstetric doctor.
Definitely.
And then take care of that. Otherwise, they might get secondary changes. That will be,
and that is the time when from our point of view, it is definitely like I told you. So if there is some deficiency there, we can give the supplementation, and you know that will help them get rid of their symptoms. Symptomatic relief will be there. But if it is like you know, really they're facing some problems with, you know, with their back pain, with the knee pain and all that, so that is where we we take a back seat. So the advice is to go to the orthopedician and the physiotherapist. Like,
yeah, we all are teams.
Yeah, exactly. So it is like we have to help them best with whatever help. Every person's, you know, the symptom with what they come is different for every person. So it is like, you know, some people are just facing gynec, like hot flushes and mood changes and all those things. So that is where we can help.
Correct.
But those people who have, you know, sometimes they come with us straight away that I'm just having a lot of, you know, so difficult to walk, my knees are so painful, my back is so painful, all that. So for us, just giving the supplementation is not going to help them. It will help them, I'm not saying it won't, but definitely not for a long period. So the long term effect will come only when they visit the physiotherapist and the orthopedician.
What about the incontinence? Because we get a lot of patients related to this problem.
Sometimes, you know, initially they are little hesitant. They come, some of them initially itself they share, and in the initial stages if they're sharing with us, before we can, you know, go ahead with some we do have medications for that also in the initial stages. But if it is initial stage right away in the beginning, you know, wherein we feel that probably, you know, some exercises and all that can help them strengthen their muscles and all that. So that is the time when the exercise part of it can play a role.
Very important. Otherwise it may lead to prolapse.
Yeah. And that, you know, there are sometimes surgical intervention is also required. So if it's in the early stage, we can do something about the management.
So yeah, people are not, I mean, especially women are not, you know, comfortable talking about all this.
Yeah, sometimes they hesitate, they come slightly at a later stage wherein it becomes a little complicated.
So yeah, they have to appreciate their organs,
reproductive
organs.
So the awareness is that, you know, come out and, you know, you have to meet the professional, whoever is going to help you. They may get confused. They can go to their family doctor also, definitely, because the family doctor probably is the first person that they go to. Then they normally will send to either to us or to the, like, whatever they require. And even if they're coming to us, we can guide them. Okay, fine, your, you know, condition is such that at this stage, that is the exercises can help you. Fine, you go and meet this doctor. Like. So
and
that
also
is the time.
They should know about the condition, like maybe incontinence, or pelvic floor dysfunction. They should have some idea that what the problem is about. So that they can go to the right source, right doctor. Because doctors don't have enough time to explain sometimes. So they should be aware of those problems.
And another thing that they have to, first of all, you have to tell them there are many women out there who are facing the same problem. So it is not like you are the only one. So it is, you know, you are part of a group. You're one of the group. So it's okay.
Everybody faces so lifestyle problem is everywhere.
At one point of time, some point of time, everybody is facing one of these problems. So it's okay to talk about it.
So I think, what is the last message you want to give? Already given a lot of messages. What is the last message you want to give to all those women?
Actually, we keep saying that women have to talk about their problems. Generally, it is, you know, what we've seen with lots of women, it is okay, like sort of fine. Let me look after, means I'm looking after my family, I have to look after this person, that person in the family, that's fine. But also look after your health, because you falling sick is not going to help anybody. So you have to talk, you have to seek help and take guidance. You may be confused at whom to go to. Then you must be knowing one doctor whom you go to, whether it be a gynaec, whether it be a physician, whomever. At least talk to that doctor, they can guide you. There's so many times, you know, women who are very comfortable with us probably for a long period of time. She comes and shares that subject or that problem may not be related to my, you know, field at all. But I definitely tell them that you have to meet this person, so you have to meet this doctor for this problem. So that's okay, they will tell you, the doctor will help you in that.
What advice you would like to give those families who are actually, especially men, and other family members, because I have seen that, you know, women health is a taboo subject still in India.
Correct.
And they feel shy talking about these problems to their men in the family. What message to all men who are taking care of women?
There are lots of men who come out and support their wives. They come with their wives and they talk about it. That's a nice thing which you are seeing, at least in the urban setups. They're doing that. One thing is another that, you know, sometimes it's like, especially for menopause and all that, one thing which I have seen quite often is like, they say, whatever happens, she's putting it down to menopause. What is that big deal? So if you really have any doubts, you can read about it. Now it is like you doing a Google on everything. Why not do a Google on menopause?
Of course.
Why not do a Google on the OPS, and even for the pregnant women also. There's so many times they face lots of problems, and there are sometimes psychological issues also which come up, especially in the postnatal period. But please don't ignore it. That's one thing, that she may genuinely be facing some problems. So if you feel that like you're not understanding it, you can talk to the doctor whom she's meeting, or else at least do a Google on that. Because sometimes it's like we say that Google पढ़ के doctor मत बनो, that's a different thing. But information, for getting the information, you can always look up something, some genuine article or something like that. So then they will be better able to understand that what is the problem that she's facing, and like what can be done to alleviate it.
Yes, absolutely. That's what we are doing is we have organized this webinar for both men and women.
Correct.
We're coming up with pelvic floor dysfunction awareness program for 3 days workshop.
Yes.
And not only for women but also for men.
So they understand it better. Sometimes like it's a very an unknown area.
Yes.
So
as
people
we
have
see our
less
face
information,
every day.
less information about it. It's always okay to know either from any source, whether it be a book, whether it be internet, or best if you could meet the doctor and ask the doctor about it.
Thank you so much, ma'am.
Welcome. If I could help in any way, that will be nice.
It was a very interactive and informative session.
Thank you. Thanks.
And I loved it. And I personally believe that like gynecologist or doctor and physiotherapist can work together in many ways. Especially
definitely.
We are expert in exercises. So
Exactly.
whatever you feel like where exercise can play a role in taking care of people's health, then definitely we can work on that area. Thank you so much. See you again.
Welcome.
Thank
It
you.
was
Thank
nice.
you.
It was a pleasure.